Let's now have diarrhea, case histories 1 and 2. A 37-year-old man had been suffering from diarrhea for 2 years. It started suddenly 2 years before in the autumn. At that time, he also had a fever and nausea. He was prescribed antibiotics, but this did not help at all. His bowel movements, of which he had 3 to 4 a day, were always very loose, with some cramping pain during evacuation. He also suffered from a feeling of fullness and distension, and his appetite was poor. His head felt muzzy, his thinking foggy, and his body felt heavy. His tongue was red with a thick, sticky yellow coating. His pulse was slippery. So this is the tongue of the patient. As you can see, you have a lot of dampness affecting the intestines. This is a very clear condition of damp heat affecting the intestines. Diarrhea with cramping pain, feeling of fullness, sticky yellow tongue coating, slippery pulse. The muscles, there's feeling of heaviness, and the head, the muzzy head. The treatment principle adopted was to resolve dampness and clear heat. The main acupuncture points were stomach 25 to stop diarrhea, spleen 9 to resolve damp heat, stomach 37 for chronic diarrhea, bladder 20 to tonify spleen to resolve dampness, bladder 22 to resolve dampness from the lower burner, bladder 25 to clear heat in the intestines. Next, we have a case history involving a 55-year-old man who had been suffering from diarrhea for 3 years. His stools were always loose, often like water, and were mixed with mucus and blood. He had several movements a day, mostly in the morning, and these were also quite urgent. On interrogation, it transpired that he had actually had the very first symptoms at least 8 years before, when his bowel movements became more frequent, albeit without mucus or blood. In fact, his symptoms had started soon after a hemorrhoids operation, when he started to suffer from frequency of bowel movements with bitty stools, flatulence, and distension. A connection was observed between the hemorrhoids operation and bowel diseases in other cases. His tongue was slightly red with a thin yellow coating, and his pulse was slightly slippery. He was a strongly built man, and he did not suffer from any other problem. Neither had he had other problems in the past. Because his tongue did not have a thick, sticky coating, and his pulse was only very slightly slippery, the diagnosis was that the diarrhea was due mostly to spleen deficiency, and that the bleeding was due to deficient spleen chi not holding blood. Thank you so much for your attention.